I want to support the call of Dr. Cuellar and many others, because even representatives from the private sector have come to the realization that the Ministry of Health needs a lot of help where leadership is concerned. We have a minister who is administrating with a lot of arrogance and ignorance, and we have a CEO who has a medical background, but who has been sidelined. And in my view, the only thing that I can tell you about the CEO is that I've received many termination letters with her signature on it. Outside of that, I've not seen a single response to our concerns within the Ministry of Health coming from her. So perhaps it's not only the minister that they need to reconsider. But the Ministry of Health is in crisis, and so we must call on the Prime Minister to look at a possible way of addressing that. Our members and public officers within the Ministry of Health are suffering, especially our essential services workers. They're not getting the kind of attention. The Belizean people are hurting, and the focus seems to be procurement, deciding who gets these contracts, who will do the procuring. The priority there seems to be, I just received some information that there's abuse where government fuel is concerned. There's an allegation that none other than the minister's son is driving around with a government fuel card. I am in receipt of instructions from the Minister of Health, and I quote, to the C.E.O, dated November the 5th, in which he stated to the C.E.O, kindly note that as of today, 5th of November 2021, no purchase orders, no invoices, no contracts, no agreements, no payments in excess of $3,500 is to be made by you without my express prior consent. We have our minister who has lost his way and who is not familiar with how the public sector runs. And sadly, I would have expected that the CEO would have responded to this and say to him, sir, the least you could do, man, that read the Constitution, man, read the legislation, which makes me the accounting officer. And so with all due respect, you need to stick to what you do best, which is